Hi folks. After lots of considering whether or not I should do this, I've decided tonight, after speaking to another woman who has suffered birth injuries, that we have to do something to make the system realise that as mothers we've been left. Hopefully the videos that I do on YouTube will be about my story and about the troubles I had going through with the hospitals, with the legal system, with trying to get justice for the injury I was left with. I'll also be speaking about the different types of deliveries that can cause injuries, because it's not something that as a pregnant woman I was ever told about. I think we all know about the regular tear that you can get while having a baby, but I had never heard of a third or fourth degree tear that would affect your sphincter muscle, causing bowel incontinence and different things like that. There's also another side of mine, being the post-traumatic stress, the depression that I suffered, and what that led to throughout within the last 9 years. I've decided to name the hospital that I gave birth to my son in. I'll also be naming the doctors, not because I want to shame anybody or get anyone in particular into trouble, but because it's my story and it's unique to me, and I'm sharing the details with people. I think it's only fair that I let them know where I was when this happened. Tonight I'll give a wee bit of an overview about what this is going to be about my story, and then I'll be putting it on YouTube. If you can share, like the page, ask any questions. I'd also like to say at the beginning of this, I am not medically or legally trained. The information and knowledge I have is something that I've gained over time through reading, speaking to experts, and basically researching what should be going on. A lot of things I'll be talking about will be guidelines and protocols that come from the Royal College of Obstetricians and Gynecologists, the midwives, niece who oversee the guidelines and protocols, and I'll be giving you a wee update on what happened when I contacted the General Medical Council and different people like that, and what kind of response I got. So if there's anything particular that you want to ask that you think I might know, I'm more than willing to ask any questions. My story started 10 years ago, past in March the 28th. I gave birth to my amazing son, and just from the start, he is the one thing that's made this all bearable and worthwhile. This was a pregnancy that I had after suffering an ectopic pregnancy in the April of 2007, leading to have a tube taken away. So getting pregnant, I was 37 at the time, thought was going to be quite difficult. But we went on holiday to try and recuperate, because it was a full-blown surgery I went through, so I had a wee bit of recovery that I had to do. We went on holiday, and to my surprise, when I come home, I found out I was expecting, which was great but frightening also. On finding out I was pregnant, I was given an appointment to go to the early pregnancy clinic in the RAH in Paisley because of my past history. And I was consultant led, so I was given a consultant who would see me on a regular basis to continually check that everything was okay. Consultant I had was Dr. Robbins, who was a great consultant, listened to me and saw me often. I viewed various things from my pregnancy. I had an awful pregnancy. I developed the pregnancy itch. I developed just lots of different wee things that were going on, or I thought they were small things, which actually at the end up, on the day that I did give birth to my son, I went into labour on my own. I was a week early, but the day I went into labour, my son, and I gave birth on the 28th, they actually found out that I had been suffering from a thing called sorry guys, peripartum cardiomyopathy, which is heart failure basically that's induced by pregnancy, and they didn't know this. So all the kind of symptoms I'd had, swollen ankles, different things like that, had been due to the fact that I was actually suffering from heart failure, which was missed. So 12 hours after giving birth to Kai was basically a blur. I was left in a delivery room with 2 midwives looking over me. They initially thought I'd had a heart attack, and then they thought I'd had a thing called HELP syndrome, which is, for people who know about preeclampsia, this is the next step up from HELP syndrome, from preeclampsia. And with HELP syndrome, it affects the heart and can cause cardiac arrest. And that's what they were afraid of. I actually found out after it that they actually had the paddles outside the door to restart my heart if I had went into cardiac arrest. 10 hours after giving birth to Kai, I was told I was being moved to coronary care, and at the time my gorgeous, beautiful baby was transferred to special care. At the time we didn't know there was anything wrong with him. We thought he was just going there because I wasn't there to look after him, but we found out later that he had his own problems. But go back to me, and going into coronary care, the next day was a Saturday. I delivered kind of Friday mornings, and the Saturday the consultant came into the hospital to see me and said, looks like you have had some kind of heart thing going on, not 100% sure what it is, but we might need to send you for more tests. So that was on the 29th of Saturday, and I was in coronary care and was there for the next 5 days. Within those 5 days, maybe the Sunday after it, I developed a really, really bad pain in my buttock, my right buttock, and my buttock went completely black. I couldn't even sit on it. I was being transferred from coronary care over to special care to see Kai, and when I was going across, I had to go across with a porter and a nurse and in a chair, and I couldn't even sit. I was actually like holding myself up on my other buttock so I didn't need to sit down. The pain was something I've never experienced in my life. So that went on for 5 days, and they decided they would just give me morphine. They were giving me injections of morphine, saying, don't worry about it, it's just because you've just had a baby and it's just your body getting back to normal. Which, being a first time mother and never given birth before, thought, okay, that's fine. They decided early on in the week that they were going to send me to Glasgow Royal Infirmary to see another heart specialist, where they could perform certain types of tests to find out whether or not my heart had been damaged, or had I had a heart attack and I needed a stent put in. And so on the Wednesday, I knew on the Tuesday night that on the Wednesday I was being transferred. I was being transferred by ambulance, and they were giving me again morphine, and they gave me morphine that morning. Went in the ambulance. 2 guys were great, transferred me over, got to the ward mid-morning, and was in a room with just me and another older lady. I had phoned my family to let them know that I'd been transferred, and my 2 sisters and my mum were coming to see me at visiting time. And when they came up, I was literally crawling up the bed with the pain. I have never ever felt anything like it. My older sister went out and said to the nurse on duty, look, someone needs to go in and see my sister, she is in so much pain. But bearing in mind I'm now in a coronary care ward, which obviously deals with the upper part of the body and not the lower part, I think the nurses who were on duty were a wee bit perplexed by what may be causing it. I told them that I had been getting morphine injections, and they said, okay, after visiting we'll come in and we'll give you the morphine injections, which they did do, and I must have dozed off. I wasn't sleeping for that long. It must have been only a case of about 20 minutes, and I wakened again with pain, but in putting my hand underneath the covers and removing it, found that my hand was covered in blood. I buzzed for the nurse to come in, and the look on her face, she was totally horrified. She had no idea what was going on, and basically pressed the emergency buzzer. And at that time, I was losing lots and lots of blood. Within, and I couldn't tell you the time limit, but it seemed like a few minutes, there was maybe about 10 doctors and nurses all round about me, trying to wonder where this was coming from. Somebody had said, oh, maybe your stitches had burst, because when I delivered Kai, they said I had a 1st degree tear. So they said, maybe your stitches have burst, and somebody else said, no, she wouldn't be bleeding like that. Anyway, it turned out I had to be transferred up to intensive care, and there was a Dr. Lyle, who was obstetrician gynaecologist in the Glasgow Royal, in the maternity unit, and she came over, and they decided that I needed to go for surgery. I was actually haemorrhaging, and they told my husband, basically what happened was, when I delivered Kai, I had an assisted delivery, which was a suction cap. Some people might have forceps, different things. I had the suction cap. People who have forceps or any kind of assisted delivery are more at risk of developing a tear. And guidelines and protocols within the NHS state that any woman who has an assisted delivery should be treated as though they have a 3rd or 4th degree tear until proved otherwise. Now, a 3rd or 4th degree tear is when the sphincter muscle is torn. You've got an internal and external muscle. Both of these can be torn. One can be torn, it's different, but they say that the only way to repair this is to go to theatre straight after giving birth to your baby and the surgery is completed. For me, that didn't happen. I didn't even get an internal examination. I had what they call a look and see, which was the doctor who delivered Kai. Had a wee look, said, yeah, she's fine, 1st degree, stitch her up. So that hadn't happened. So this doctor had said to my husband, she's been left in a real mess. She has a tear in the back of her vaginal wall, which is 6 centimetres, and is haemorrhaging into her buttock. And that's what's been happening for the last 5 days. She needs emergency surgery. Now, because I had heart failure, they had to wait for a senior anaesthetist coming in because they were concerned about how I would react under anaesthetic. So although this bleeding and everything had maybe started about 4 o'clock in the afternoon, 3:30, I didn't get into surgery till about 10:30 at night. And basically my husband was told to expect the worst. There was no guarantee that they were going to be able to save me and what was going on. I went into the surgery, and the last thing I remember is being wheeled into this operating theatre with what looked like 20 nurses and doctors all standing gowned up. When I got wheeled into the operating theatre, I was still awake, which kind of shocked me a bit, because any time I'd been to hospital, I'd been put to sleep in the room beforehand. And I remember being quite teary, and I remember still having my engagement ring on and my wedding ring, and I remember saying to the nurse, I've still got my engagement ring on. She said, Pet, don't worry about that, we'll cover that up. And I think afterwards, and in hindsight and thinking about that, anyone who's ever been for surgery, you know yourself, they don't like you to wear rings or anything, and my engagement ring has a diamond in it, which is quite high, so I thought, well, that they really need that. In hindsight, knowing that they weren't concerned about that made me realise that this had been really pretty serious. I went through the surgery and was kept in intensive care overnight with a nurse sitting at my bedside all night. Luckily, I came through, and I went the next morning and I got the various tests I was going to have, and then spent the next 5-6 days in coronary care at Glasgow Royal with a drip in my neck, and my baby 12 miles away in another hospital, which was awful. I remember after having the surgery and being transferred to coronary care, I remember in the morning, quite soon after the surgery, and having this fear that the pain was going to come back. And I remember crying, and it was an auxiliary that was in, and she said, Pet, what's wrong? And I said, I'm so scared. I am so scared that this pain is going to come back. The pain was excruciating. It was something I have never experienced in my life. And she said, oh, come on, you'll be all right. And yeah, I did. I managed to say, okay, I'll be fine. But that was difficult. That was very, very difficult and very, very scary. So I spent another 5-6 days in coronary care, and then was allowed to go home to get my wee boy out of special care. He had problems of his own, and in the year or two to follow, he needed surgery as well. But at the time we didn't know what was wrong with him, and there was lots going on there as well. I eventually got Kai home after he was 13 days old when I got him home. And my weight had dropped to 6.5 stone. I was so skinny. I'd lost so much weight. I was so weak. I was so tired. But I had a wee baby, and there's nothing I could do. I had to get on with it. I did contact the hospital, and Dr. Robbins, my consultant, had apologised about what had happened with the hemorrhage and everything else, and it should never have happened, and had arranged to meet me and my husband at the end of the April to talk about things, which we were quite happy about, because at the time I thought, well, you know, does things like this happen? Is this normal? Is it natural? I didn't know. So for the next 6 weeks or so, I'll try to look after Kai and look after myself, and then the day of the meeting came, and we went up to the RAH and had the meeting with Dr. Robbins and a sister who was in charge of the obstetrician and gynaecology ward called Sister Mannion, who was lovely. We had a meeting with them, and they apologised about what had happened. They spoke about the tear, saying that should never have happened. It was awful. And they also spoke about the heart failure, saying that cardiomyopathy in pregnancy is very, very difficult to detect. And I'd asked to meet with the doctor who delivered my son, and he refused to come to the meeting. I wanted to know why this tear had been missed. I think it's really, really important for me to point out here, tears during delivery are very, very common. But tears that are there during delivery or because of delivery should be detected by proper investigation, proper examination, by going through proper guidelines and protocols to rule out anything that would make the condition more serious. The need to tell women what the possibilities could be is enormous. If someone had told me that if you have vaginal delivery and you have an assisted delivery and we need to use forceps or a suction cap, you may encounter a 3rd stroke 4th degree tear. Now that means that you may become bowel incontinent or bladder incontinent. There's many women suffer bladder problems as well. I never get told any of that. Nothing like that. But I wanted the doctor who delivered Kai to come and tell me why it happened. Why did you not examine me properly? Why, but he didn't come. Dr. Robbins apologised on his behalf and said it should never have happened. And then said to me, is there anything else wrong with you? And I said, no, I'm fine, I'm okay. And my husband then turned around and said, no, she's not. She's not managing to make the toilet. She's suffering from accidents when her bowel's open. Dr. Robbins said, is this true? And I said, yes. He said, okay, well, we need to now refer you to a colorectal surgeon who's a bowel expert. We need to find out why this is happening. It may be something to do with the birth. I said, okay. So that was the end of April, and it was about June before we eventually got to see someone. The colorectal surgeon was very nice and kind of explained what may have happened, but I was still unsure, as being a first-time mother. Did this happen? Did it take time for your body to go back to normal? But at the time they decided they would carry out numerous tests to find out whether or not it was something else that was causing it. They sent me for a colonoscopy, and I was in for various things. They thought I might have had a tumour in my large intestine and different things like that. So that was the June. By the February of 2009, that's nearly 12 months after having Kai, they actually said that the reason that you're bowel incontinent is because your inside sphincter muscle has been torn. There is a tear in it, and so it's not managing to close. It's almost like, the way I describe it is like putting a tap on and not putting a plug in. So if there's no plug, the water won't stop. Well, it's like me. The sphincter muscle doesn't close, so I have no control over what's going on. And they decided I needed surgery to try and repair it. The surgery was going to take place in April 2009. Kai was 13 months old, and the surgery would leave me wearing a colostomy bag for maybe 7-8 months, because when they repair the back passage, they need it to heal, so anything that's coming from there needs to bypass and go into a bag. I had the surgery in the April, and it turned out that they actually couldn't do a colostomy bag, they did an ileostomy. The difference for that is a colostomy bag is something that's attached to the large bowel. Now, your large bowel actually produces formed feces, if you like. It's formed, it's like you see. The small intestine is the bit where all the watery stuff runs through before it gets to be like full, like, you know, compact, if you like. So what I was finding is, they had said to me that people manage with colostomy bags fine, because they can normally determine that if you eat at 8 in the morning, you'll know that at 9 you need to go and empty your bag. You have to dinner at 4, you need to empty your bag at 5, and that's the way a lot of people who have a colostomy bag work it. With an ileostomy, it's completely different. The bag constantly fills with fluid, constantly. It's just something that happens with it, and I really, really struggled with it. I struggled with changing the bags, I struggled with everything, you know, and the nurses and everyone in the ward were amazing. You know, it was like, you need to look at it, you need to be able to clean it and change it before we can let you go home. They came to the house, they watched me, but it was because it was an ileostomy. Again, no one had told me that this might be an option, it might happen, so I was unprepared for this as well. I wore the bag for, I think it was about 7 months, and then they had said after that they would do a reversal. So they would take the bag away, sew up the bowel again, and let my waist come away from normal. Unfortunately, it didn't work. Now, folks, I've been on for 23 minutes, and I know it's a long time, so I'm going to try and keep my post to maybe 20-25 minutes. I really hope that people that watch this get some kind of understanding about what they've been through. The next couple of posts that I put up will be about how I managed after that and what they did, and then I'll also start talking about the legalities of things. Lots of people said to me, oh my god, your story's horrendous, did you not sue them, did they not, you know. As of now, 10 years after giving birth to my son, no one in the NHS has taken any responsibility for this. They have played their trump cards when we've been at court. I've had 4 or 5 lawyers walk away and leave me, and I've been on my own in the Court of Session in Edinburgh defending my case and trying to keep it running. But that's another part of the story, but that's what it will lead on to. Please guys, like the post if you do like it, or even like it because you know I know it's not something to like, but something that may help other people. Please share it in any groups that you're in. Tell women that are pregnant they need to know, they need to be going asking these questions. You know, what if I need an assisted delivery? You know, that should be all arranged before anyone goes in to have a baby. But I hope this post will maybe help some of you, and I'll be back on the next few days to put the next part up. Okay, good night guys, thanks very much, speak soon.